Welcome everyone, and thank you for joining us today for the Healthy Northeast Ohio Regional Community Health Data Platform session. My name is Robin Hepler with the Ohio Hospital Association. Today our presenters are Patricia Terstiniak, Libby McGraw, and Sarah Sabo. Before I turn it over to the presenters, I need to review some housekeeping items. Please note this session will be available for viewing on the OHA meeting site after June 9th under the On-Demand Session tab. Please check the OHA meeting site for details on continuing education credits approved for this session. After the session ends, you will see a pop-up window on the right side of the presentation window with a link to complete your evaluation. You must complete the evaluation in order to obtain your CE credits. Now I'll turn it over to our speakers.
Hello, and thank you for joining this session on Healthy Northeast Ohio, a regional community health data platform. We invite you to follow along with us by visiting healthyneo.org. The website again is healthyneo.org. We want to make mention that we are recording this session in March, and there may be some website enhancements when this session is viewed in June. Let us start with introductions. I am Patricia Terstiniak, and I serve as the Director of Community Health at the Center for Health Affairs. The Center is a regional hospital association where our aim is to be a convener, influencer, and innovator that impacts health in the communities we serve. Next to me is Libby McGraw, the Regional Community Health Improvement Manager, also with the Center for Health Affairs. Next to Libby, we have Sarah Sabo, our data analyst who works at the Cuyahoga County Board of Health. And their mission is to work in partnership with the community to protect and improve the health and well-being of everyone in Cuyahoga County, and in this project, even beyond. And I must tell you, we have so much fun working and learning with each other daily, weekly, monthly. Here is the agenda for our time together. We will tag team this presentation with smooth as possible transitions. We are hosting a live Zoom Q&A afterwards, and we hope to see you there. The objectives for today. Participants will be able to demonstrate on how to access over 225 health and quality of life indicators to help with data-informed decisions for programs. Participants will also know how to explore regional, county, and local health data trends over time to have an increased awareness of community health topics in their local areas. So our aim is that we hope you can find the data, use the data you need, and have an increased understanding of community health priorities in your area. A little background information of this project. The site launched officially on December 5th of 2019. We started off with 5 counties, and now we are in 7 counties, as you see on the slide. And we are so happy and excited to continue to partner with hospitals and public health departments and others who are in this space of community health improvement. We utilize the Conduent HCI platform for our website, and as we go throughout today's presentation, you will learn more of how we obtain and ascertain data. All of this work is currently funded by the HealthComp Foundation and several other partners, including hospitals and public health departments. Ongoing partnerships and sustainability efforts make this work possible. Libby will now take the lead.
Thank you, Patricia. Welcome, everybody. We are so excited to bring you this information today. Whether you're joining us from home, from your office, in a safe, socially distanced environment, we do have a quick question to get us kicked off this morning. Have you visited healthyneo.org before today? So as we're sitting here kind of reflecting on the information we're going to bring you today, we invite you to think about that. And we hope after today that you feel a little more comfortable visiting our site and accessing the tools and resources that are available through that. So I'm going to take the next few moments of our presentation today to review the Community Health Needs Assessment, or the CHNA process, that our hospital systems are familiar with. In addition to using the Healthy NEO website as a tool to access data, our platform can also be utilized to assist hospitals with that CHNA process. So here on our slide, we have outlined just a couple of those bullet points for you to consider as you visit our website for guiding that process. So first up, the neutral and common platform that we have available through Healthy NEO is very easy for our community partners to use. Our public health departments and public health agencies that we work with do rely on this population health data, and the site can satisfy that need for improvement efforts. The platform also provides accessibility of centralized data for completing secondary data analysis, and this can be used for activities such as sharing data for measuring health indicators, making comparisons across sectors to align strategies, make comparisons to other locations, prior values, national benchmarks, viewing trends over time. And also shortly after we finish up my portion of our presentation, we'll be reviewing some of those tools. And lastly, the platform can be used for simple data visualizations to tell the story of a community or a service area. Significant health needs in a service area can be identified through the platform by conducting these secondary data analyses and objectively looking at those health needs in communities. Our data does come from neutral, reputable sources, which I'll showcase here in a few more moments. Partners do have the availability to use this platform to track progress, and this helps with further sharing of priorities and increasing transparency among our public health sectors. So overall, Healthy Northeast Ohio can support shared action in service areas for that CHNA process. Living documents can be developed in the form of dashboards to engage community partners, and this can lead to shared action. Users can also link existing reports and best practices within a region, and this can aid to transform data into shared action and ultimately improve those health outcomes. So before we switch over to our website demonstration, I do just want to point out some of these pictures that we have up on our slide on the right-hand side. This top photo that you'll see was brought to you by Conduent HCI, and this is a great visualization of those steps that are involved with that CHNA process. And the bottom picture where you see the 3 different blue buttons, that is a direct screen grab from our site where we also have a Conduent HCI tool that you can utilize for the process. So I'm going to go ahead and switch over to our website. So here we have healthyneo.org. Again, this is a free and publicly available site. And one of the first things that I would like to showcase on our site is our data sources. So here we have our various sources where our different health indicators come from. We have over 30 different sources from state, local, and national resources. And this is available on our website if you would like to review that. So going back to our site, I will also show you what indicators we have available. So if you go to Explore Data and click on Indicator List by Location, you will have access to our more than 225 health and quality of life indicators available on this site. These list them out in the geographic location that they're available at. So you can scroll through and you can look in different health topics and see what indicators we do have available. If you would like to download all of the indicators that we do have available, you can click on this link right here to download that in a CSV file. If you would like to explore more data, or if you would like to search for some specific data topics, you could hover over Explore Data and visit Search for Data. And this page would enable you to search by keyword, search by location, look for a specific indicator. We also have quick links to different pages within the site, so this could help get you kickstarted with that data searching journey. Now, the next section that I would like to show is our Topic Center, and this is a good resource if you're new to the site, if you're just starting to learn a little bit more about what we have access to. So down here in the blue, and this footer will be on every page on our website, you'll find our Topic Center. And this is a great way to bring together related content. So I'm going to click on Community. And this will pull up all the information that we have on the website available about community. So you'll see that it has pulled together indicators, promising practices, different resources, websites. So if you click on the drop-down button here, you could access all the other topics that we have access to. So that's just a quick and easy way to bring together information that's related. And I do want to point out our tools and resources. So we do have some great tools and resources. We invite you to visit all of these at your leisure. And I do want to point out just a few of them this morning. We do have our COVID-19 resources. And right now we have been changing it as the landscape of COVID-19 also changes. But right now we're showcasing different links for our hospital partners and our public health partners so that we can bring information about the COVID-19 vaccine to people who visit our website. We also have promising practices, and this is a database with over 2,000 evidence-based practices, effective practices, and good ideas. So as you are possibly going through that CHNA process, developing those implementation strategies, this may be a good resource to look for those effective and evidence-based practices to consider for implementing in your own community. We also have a resource library, and this has access to fact sheets, reports, all sorts of local and national resources that we have available that have been shared with other partners, other community entities. So this has a lot of great information as well. And the last resource that I would like to touch base on today is our CHNA guide. And this is a tool that was created by Conduent HCI that we have access to through our website. And this is a great tool to get you started on that process. So again, you'll see these 3 buttons that link you to the different phases of that process. So if you click on one of them, it'll bring you to the different steps to get you started on that process. So this is a really great and interactive way to just visit different portions of our website to help get you started in that process. If you're starting to look at defining service area, it'll walk you through some of those tools and resources to move on to that next phase as well. So this is a great tool that we definitely wanted to share with our partners at the Ohio Hospital Association. And that is the last tool that I'm going to be showing this morning. So I will go ahead and turn it over to Sarah Sabo, who will get us started with some other features on the Healthy Northeast Ohio platform.
Thank you, Libby. I'm just pulling up the site now. Again, good morning, everyone. Thank you for joining us. So now that we've provided you an overview of the Healthy Northeast Ohio site and shared how it can be used to help with your community health improvement efforts, I am going to be walking you through some of our data-related tools that are available on the site. So in addition to all of the indicators that Libby shared with you, Healthy Northeast Ohio also has several specialty dashboards and a few curated dashboards. And keep in mind that a dashboard is just a collection of indicators around a topic, location, or other element. So I'm going to start by showing you the specialty dashboards available on Healthy Northeast Ohio. So to navigate to those, you would go to Explore Data, then Specialty Dashboards. The first one I will show is the Demographics Dashboard. And this can be used to research the demographics of your community or your service area. It contains 250 demographic variables that are available at the state, county, and zip code levels. You can click View All Demographics to the right if you want to see that complete list. And then also, really on all of these specialty dashboards, you're going to see a drop-down menu where you can select the specific location that you are interested in. But you can use this dashboard to look at the distribution of your community or service area, the population by race, ethnicity, age, sex, and other available subgroups. This data allows you to view and download maps for these individual variables if you click on them. And you can also see that there are a variety of graphs that are used to display this data. And lastly, you can also use this data to assist with calculating rates, for example. Several of the specialty dashboards can also be used for conducting secondary data analysis and for comparing to national benchmarks and identifying disparities in your community. So the next specialty dashboard I will show you is the Healthy People 2030 Progress Tracker. So this can be used to compare your community to these Healthy People 2030 objectives. So these national targets provide a benchmark for communities to work towards and can also be used for setting goals or targets. You can select a location, again, using that drop-down menu, and you can see how it compares to the targets. So in this dashboard, you will see a red X icon, which would indicate that a target is currently not being met. And then you also see a green check icon indicating that a target is being met. Within this dashboard, if you do click on an indicator, you will be taken to the indicator detail page where you can learn more. Next is the disparities dashboard. So this can be used to look at differences in health between groups. You could use this dashboard to help identify those groups to focus your community health improvement efforts towards and to drive action. This dashboard allows you to view indicators that have subgroup data available by race, ethnicity, and age and gender. You can see how these values differ among various subgroups and how subgroup values compare to the overall value for a population. So breakout values that are significantly better or worse than the overall value, you'll see highlighted in either green or red. And keep in mind that the availability of this data depends on the source that the data is coming from. In addition to identifying disparities by race, ethnicity, gender, or age, the site can also be used to help identify geographic disparities. So next, I will show you the Socio-Needs Index. So this is a tool that was created by our vendor, Conduent HCI, and it summarizes multiple socioeconomic indicators such as poverty and education into one composite score for easier identification of under-resourced areas. So as we know, social and economic factors are strong determinants of health outcomes. This tool highlights socioeconomic disparities within a community and can be used to help with program planning and in determining where to focus community health improvement efforts such as services and interventions. In a nutshell, how it works is that all census tracts, zip codes, and counties are given a national index value that ranges from 0 being low need to 100 being high need. Then those national index values for each location in a community are given a rank from 1 to 5, with 1 being low need and then 5 being high need. So in this map, the darker the blue, the higher the need. So this needs index map can be downloaded by clicking in the right-hand corner here. It can also be filtered if you want to look at just one specific county, and then the zip codes or census tracts that make up that county. You're also going to see a bar graph here. So this is showing all of the values for the zip codes in our region, as well as a table. And this data can be downloaded by clicking CSV just above the table. And then the last specialty dashboard I will show you is the Food Insecurity Index. And this is a brand new tool that also was created by Conduent HCI, and it's a measure of food accessibility that's calculated using social and economic factors, such as household expenditures, that may impact a household's ability to purchase food. This index can be used to identify census tracts and zip codes with the highest estimated food insecurity and can help determine where to target efforts. It works very similarly to the Socio-Needs Index, where all census tracts, zip codes, and counties are given a national index value, and then those are then ranked from 1 to 5. In this map, the darker the green, the higher the estimated food insecurity. Again, just below the map, you can use those filter options, and this map and bar graph are also downloadable. And you can also download the data, again, by clicking CSV. So that concludes the specialty dashboards. We know that integrating local data with other community health data can help provide deeper insights into local issues. And then another advantage of local data is that it can be more up to date sometimes than data from secondary sources. So local data can be added to Healthy Northeast Ohio, and we do have several curated dashboards, which are just pre-built, customized dashboards that can be created on the back end of the site. And these curated dashboards can include indicators that are either maintained by Conduent or local data that we add. So I thought I would just show 2 quick examples of curated dashboards that have local data. So the first is this 2019 Cuyahoga County CHNA dashboard. This includes select indicators from the 2019 Cuyahoga County CHNA. Just scroll down. So this is an example of more of a living report. So it's interactive. So if site visitors are interested in learning more about an indicator, they can click on it to get more information, and it is dynamic. So as we receive new data, this dashboard will be updated. So this can definitely be more engaging than a static PDF type document or report. And then the second local data curated dashboard we have on the site is this Cuyahoga County Childhood Lead Poisoning Dashboard. Again, just another example of how to integrate local data on the site. So that covers the specialty dashboards and curated dashboards that we have available. So next I'm going to show you some examples of ways to visually represent data using the data related tools on the Healthy Northeast Ohio website. Using these simple data visualizations really helps make sense of the data and to tell the story behind it. So the first example I am going to show you is a custom dashboard. A custom dashboard shows a summary of selected indicators and comparisons to other counties in the state or US, as well as national benchmarks. A custom dashboard brings data together in one place and can be used to help identify areas of progress or need. This dashboard, or these custom dashboards, allow you to compare your community to other locations, benchmarks, and also look at trend data. And they are dynamic. So again, as the data is updated on the site, your dashboard is automatically updated, which is really nice. These dashboards are easy to share with partners, and they allow partners to use common data for measurement and tracking progress. This tool also could be used to help with writing reports, presentations, publications, or even a grant application. And you can also embed a link to a dashboard in a document or post it on a website. So here I am showcasing a sample custom dashboard that I created that focuses on maternal and infant health in Lorain County, as that is one of their priorities. So in this column here, you're going to see the current value for all of the indicators that I've included in this dashboard. And then to the right, you're going to see any available comparisons that are available. So again, comparing Lorain County to other counties in the state, comparing Lorain County to the overall state and US values, looking at how the value might be changing over time, and then whether or not those Healthy People 2020 or 2030 targets are being met. A custom dashboard can be viewed in the list or card view just by clicking this box icon below search results. And these individual cards can be saved and shared. And then as well, like I mentioned, you can save a link to your custom dashboard. If you're interested in creating your own custom dashboard, on the website, you would go to Explore Data and then build a customized dashboard. Another data-related tool available on the website is the Location Report Builder. This is a tool that allows you to build a customized report based on indicators and then a location of interest. And it's a way that you can pretty quickly and easily pull together different components on the site into a downloadable PDF. Custom reports are more of a snapshot in time. So as the data on the site is updated, the custom report will not be updated like a dashboard would. So just keep that in mind. But these reports can be used to help tell the story of your community and can be easily shared with others. You could create a custom report, for example, that could be a community profile. It could be one that highlights a specific topic or even a priority area. So again, I just wanted to showcase an example here. So this is a sample custom report that I created that focuses on Cuyahoga County's priority of addressing community conditions. So in this report, I'll just slowly scroll so you can see, I've included 3 related indicators. And again, you can select specific components that you're interested in. There's various graphs, maps, gauges, and dials that you can include. So here I've included an indicator card at the top. So I wanted to showcase the current value and then any comparisons that were available. I've also included a change over time graph as well as a map of Cuyahoga County where the darker the blue is indicating a higher percent of people living in or below the poverty level. And I kept those components consistent with the other two indicators that I've included. So again, that's just an example of the location report builder tool that is available to you on the website. And if you did want to create your own, you would simply go to the Tools and Resources tab and then click Build a Custom Report. And then the last data visualization example I wanted to show today are indicator maps. So when you're on the site and you click on an indicator, you are taken to the indicator detail page, which, as I previously shared, is where you can learn more about an indicator. So you can see a description of the indicator, why it's important. You can see the current value, some of those comparisons that are available. And then you can also see a map, which can be viewed at various geographic levels. So right now it's showing at the county level. You could view it at first the city, zip code, or census tract level. And again, that can be downloaded. So we know mapping community health data by geography can, help tell the story of your community and where the communities with disparities might live. You may see patterns emerge in the communities experiencing these disparities. So I'm going to go ahead and just quickly shift over to our PowerPoint again. So you can also use multiple data points, for example, like these side-by-side maps, to look at an issue from multiple perspectives to better understand this story. So here I am showcasing 4 indicators for Summit County. So these are showing the rates of adult obesity, diabetes, stroke, and then adults who are sedentary for the census tracts in in Summit County. So chronic disease, and in particular, decreasing adult obesity, is a priority for that county. And we know that adult obesity is an indicator of the overall health and lifestyle of a community, and that obesity increases the risk of other health conditions like diabetes and stroke. So these maps can be used to identify potential patterns. So for example, with all of these indicators, the darker the blue, the higher the percentage for adults who are obese, adults who are sedentary, adults with diabetes, and then adults who experience a stroke. So we can see that the census tracts with the highest levels of adult obesity, right in this area, also seem to have high rates of adults who are sedentary, adults with diabetes, and then adults who experience a stroke. So these maps, they can be used for engaging community partners and cross-sector collaboration and shared action. So we hope you have a better sense of the data and the visualization tools that are available to you on the Healthy Northeast Ohio website, and also that you can see how they can be used to support community health improvement efforts. I will now turn things back over to Patricia, who is going to wrap us up.
Hey Sarah, this is Libby, and I am going to share just one more resource before we reach our concluding slides. So I'm actually going to pull up our page one more time. And thank you for that great overview of the different features of the site. We hope that that really brought a visual to everybody who's listening today, so that you have a little bit more familiarity with how to access those different tools available through our site. So thank you to Sarah for that. I am going to showcase one of our county pages. We do have 7 counties in our region, as Patricia indicated earlier in the presentation. And we do just want to quickly showcase what one of those county pages would look like, especially if you are from one of our service areas. So I'm going to go ahead and click on Ashtabula County. If I hover over Explore by County. And all of our county pages are going to be set up very similar to this one. You'll see a quick little overview at the top here with some background information about the community. And you'll also see some links to county health rankings and roadmaps. We also, if you continue to scroll down, have a couple buttons to directly link you to our various data and indicators that we have available for that community. And at the bottom of the 2 rows with the buttons, you'll see our different links to implementation strategies, health improvement plans, and community health needs assessments. So this is where you can access all of that great information about our community health needs work in that specific community. So thank you, Sarah, and I will go ahead and let you take over for the conclusion of our presentation with these slides.
Well, thank you so much, Juan, for joining us, and Sarah and Libby for providing all participants with this overview. We know it was a lot of information in a short amount of time. As you can see, our primary users are public health departments, hospitals, and other folks who are in this community health improvement space. And you can see here 2 statements of impact from our partners, which might even convey how, in a stronger way, how they are using the website, like we talked about it, but this is, that very firsthand experience. So I give you a second to read those statements. So in summary, some of the key takeaways that you can leave here today. Healthy Northeast Ohio serves as a neutral data repository. As it was shared, data comes from over 30 sources, and it's a great way for data validation. We have over 225 data indicators and more on the way as we constantly make updates and improvements to the website. We, again, want the data to be usable to you, and you can have custom dashboards, as Sarah explained. Identifying community resources. As Libby mentioned, we have changed the COVID-19 resource page so many times, to stay current and be a true resource to everyone visiting the website. We have the promising practices. My background is a lot of programs, and I just love, that information. And, we can also upload information there as well, whether if you have a resource for the library or a promising practice that you want to share with others. Also, in just keeping up with the conclusion, using the data and reports for community health improvement planning, whether you want to validate your data or, see how you're doing, or maybe you're finding something in contrast or that's very different, and, maybe it's an opportunity to dig deeper. Last but not least, if you're interested in a Healthy Northeast Ohio presentation, feel free to contact our team today. You can either do so by our direct contact information or by visiting the Contact Us feature on the website. We have given other presentations either a wide overview of how to use the website, as well as presentations on a more specific area, for example, food insecurity or housing or cancer. So if you have something specific in mind, we're more than happy to arrange and coordinate that with you. In conclusion, we hope you have learned something. We hope you are more knowledgeable. We hope you use the website. If you have any questions or want to hang out with us for a little bit, feel free to join our Zoom session. Thank you so much again. Have a great day. Bye for now.